Hello, this is Dr. David Green, CEO of the TEX-PAIN Network. Today's topic is what you need to know about trigger point injections. A trigger point is a tender and painful area of muscle. It represents a hyper-irritable spot in the muscle associated with palpable nodules in taut bands of muscle fibers. It can manifest with a tension headache, tinnitus, TMJ pain, decreased range of motion in the legs, and even low back pain can result from a trigger point. Palpation of the trigger point elicits pain directly over the affected area and also can cause pain to radiate out into areas around. A trigger point injection is an outpatient injection given into the trigger point. It can consist of dry needling, may have some numbing medicine, and also possibly some steroid added to it. Dry needling means there's no medicine at all. You don't need image guidance for this. A pain doctor can feel the trigger point area. It's so subcutaneous as well, and the needle doesn't go very deep. What does the injection help? Well, myofascial pain, which is chronic pain in muscle tissue, that works well with tender trigger point injections. Fibromyalgia, tension headaches, tinnitus, TMJ pain, and low back spasms. How's the procedure formed? Well, it's outpatient. It takes a few minutes. As I mentioned, no image guidance necessary. Needle is placed directly into the muscle area of tightness. Pain doctor will often see a small twitch and feel it too. The needle itself can relieve pain, which is why dry needling is so often performed. And the doctor will move the needle in and out of the affected area to get the best relief. And the injection can be repeated every few weeks. What are the results? They're often excellent for relieving the pain due to trigger points. It may require a repeat injection every few weeks. There's really no large-scale studies looking at them, but there's so many reports of how well that they work, even with no medication. It's a very low-risk procedure with a very high benefit. The needle's not put very deep. The worst risk is that it may not work. There's a very slight risk of infection or allergic reaction. If it's used too often, with steroid, then it can leave a dent by absorbing some of the fat in the area. The top non-operative pain management in the Dallas-Fort Worth area is through the TEX-PAIN Network. There are several clinics accepting over 50 insurances and providing over 25 different treatment options with the board-certified award-winning doctors. Visit us online today at painmanagementdallas.com and then call us for more information and scheduling at 844-TEX-PAIN. I'm Dr. David Green with the TEX-PAIN Network. Your pain stops here.